All right, so to start, we're going to talk about some facts about this intervention approach. So, to start, what is SAILS? What does it stand for? So, SAILS stands for Speech Assessment and Interactive Learning System. And SAILS is an online based program that will help aid children in identifying the correct version of the target words or sounds. So, what is the target population for this intervention? The target population is going to be children that have difficulties in phonological process abilities, such as phonological awareness skills. These clients are going to have difficulties perceiving and producing speech sounds, and typically the target of this population are going to be children around the ages of 4 to 7, but you could go outside of that range if it's appropriate for your client. So, what are some target speech sounds? For this intervention, it's going to be really focusing on minimal pairs in order to differentiate which is the target word. Typically the sound will be in the target will be in the initial position of the word or the final position of the word. So some examples of this could be, if you're using the initial position, you could do jump versus dump. And in the final position, you could use pass versus passed. So through this online program, the children will be helped learning to pick out which word is the correct target. Okay, so now that we know a few facts about this intervention approach and we know what SAILS and speech perception intervention is, we can talk about why a clinician would choose this intervention. So first, they would choose this because it is super easy to use and extremely child-friendly. The format of this program is so engaging for children, so it's really an easy choice when clinicians are trying to pick what they would put in their treatment plan. Another reason, probably one of the main reasons, is that this program and this treatment approach specializes in targeting the perception of speech sounds through recordings of contrasted speech sounds with minimal changes. So by using this, clinicians are able to really help their clients fine-tune and hone in on their own perception of what the target sound should sound like. So this is really helpful with kids with speech sound disorders. They need to understand how the sound is supposed to sound like and their perception of the sound, and this program can really help them specifically focus on that. Another reason that clinicians choose it is because it can be used in a bunch of different ways. They can use it as something supplemental to what their other treatment approach is, or it could be a standalone treatment whenever it's used for speech perception intervention. So it's good that the clinician can have the option for both different ways when using this intervention. And then finally, it's rooted in evidence-based research through a multitude of different speech perception studies, and most of those can be found through the ASHA website. There's a lot of research backing up the effectiveness of speech perception intervention and a bunch of research backing up SAILS specifically. So with all of this, it's just really an easy choice for clinicians to choose this approach whenever picking a therapy treatment.
Now we're going to dive into how to actually use this program in a therapy setting. The steps for SAILS are quite easy. It's making it very simple for children to use it on a computer or an iPad. It uses a 2 alternative forced choice identification procedure, which is basically saying that there is an X and then there's a picture of the target word, and you can choose either or. The client will be asked to listen to various samples of multiple speakers and will have to identify if the word produced by the speaker is consistent with the target word or if it is not. They will click the X if it is not consistent with the target word, and they will click the picture of the target word if it is consistent with the target word. In assessment mode, a reinforcement picture will appear just for the child's answer, just to congratulate them on answering and making an attempt. But in treatment mode, it will only appear if they get the correct answers. The clinician can assist in the child throughout the activity and provide positive feedback for correctly identified words and instructional feedback for incorrect responses. In treatment mode, you will let the child experience the consequences of an incorrect answer, meaning when they get the correct answer, there will be visual reinforcement, and when they don't get the correct answer, there will be no visual reinforcement. The child can ask upon request to repeat the stimuli and listen to the word again, and that is okay. At the end of the block, you can confer with the child and talk about their score at the end of it. You can give them positive feedback for the stuff they got right, and then you can give them some informational feedback for when they get things incorrectly. For example, you could say something like this. 2 times you've touched the picture of the book when the person said boom, like this, with your lips closed. It's not book unless the person has a k at the end of the word. Let's try this game again. In assessment mode, you do not correct the child's responses or give them an opportunity to retry the question if they make a mistake. You can, however, remind them of the instructions of the game, meaning you could say, remember to listen to the word closely before you touch the picture. Tracking progress using the SAILS app is very simple because the app automatically records how many correct responses the client received out of 10. Then the SLP can easily email all of this info to themselves in the app. Now that we know how the app works on a more SLP adult view of things, let's watch a demonstration video on how this would work in a therapy session. Hi, I'm Anne-Marie, and we're going to do some fun SAILS treatment today. What's your name?
I'm Rory.
Hi, Rory. Okay, I'm going to give you some instructions before we get started. So you're going to hear some people try to say the word book. Sometimes they're going to say it correctly, and if so, we're going to click this fun picture of the book. If you hear them say the word book incorrectly, then we're going to hit this big X. Okay, does that make sense?
Yes.
Let's try.
Boom.
Does that say book or boom? I didn't hear the word book. Did you hear the word book? Let's listen again.
Boom.
Good job. Look, a fun butterfly.
Book.
Let's listen again.
Book.
Very good.
Boom. Boom.
All right.
Book.
Good job.
Book.
All right, next one.
Boom.
2 times you click the book whenever I think I heard the word boom with a at the end. Can you say boom?
Boom.
Do you feel your lips? It's not book unless there's a k at the end. That pressure against your teeth. Can you say book?
Book.
That's right. All right, let's listen again.
Boom.
Good job.
Book.
Very good. Our overall impressions of this therapy approach was that it was very simple to learn and easy to use. We found that it was very interactive and helped engage the children in this little game that they made of creating speech perception and making it fun. Another positive thing was that it's very easy to access on the App Store and can be used on your computer or your iPad, making it portable. One negative part about this treatment is that it's limited into its speech assessment areas, meaning that it only focuses really on speech perception fully and doesn't directly talk about or help with any other speech disorders. But it does work very well in conjunction with other therapy modes and helps with the other speech assessment areas immensely when also using this. Thank you so much for watching, and I hope you learned a little bit more about the SAILS app and how speech perception is greatly important for helping with speech sound disorders.